Hi, my name is Amanda MacDonald and I'm a counsellor practising in South East and South West London and online, and I'm also a member of Counselling Directory. I'm going to talk to you today a bit about generalised anxiety disorder. Anxiety is a word that we might be used to hearing often, and it can be used to describe a normal level of worry or concern about something. However, generalised anxiety disorder, which is often known as GAD, is something quite different. So what is GAD? The NHS defines GAD as a long-term condition that causes someone to feel anxious about a wide range of events and situations rather than one specific issue. People with GAD may feel anxious most days and often struggle to remember the last time they felt relaxed. As soon as one anxious thought is resolved, another one appears about a different issue. So someone with GAD will struggle with day-to-day activities, for example, going to work, going to the shops, or even meeting friends. They have a feeling of dread or distress or agitation, and that stays with them. What's interesting to note is that the feelings of anxiety or dread or agitation may sometimes be better or worse, and that means that there may be times when the person with GAD may start to feel a bit better and begin to re-engage with day-to-day activities. What can be so cruel about GAD is that it can then suddenly dial right up again in its intensity, leaving that person back to square one, managing that high level anxiety. Another question that people have is about the physical symptoms associated with GAD. So what are these? Now, it's interesting to be aware that there are a number of different physical symptoms that we may experience. However, if you are experiencing any new or different symptoms, then do just check in with your GP. Physical symptoms that someone with GAD may experience can be extremely distressing. You may feel dizzy, you might feel your heart racing, you might experience a sense of dread or a need to get away from where you are as quickly as possible. Some people might feel shaky or notice a difficulty in swallowing or need the loo. Someone may experience all of these at the same time, and this can feel unbearable. Now, these physical symptoms are all responses from something called our autonomic nervous system. We all have it, and it's there to help us when we're in danger. For example, if you're under physical attack, it is your autonomic nervous system that gives you that boost of adrenaline to be able to run away or to fight. And what happens is after that danger has passed, our parasympathetic nervous system kicks in to turn off this reaction. However, if we feel that we are in a constant sense of danger, then our nervous system remains on that high alert. I'd like to share with you how I work with generalised anxiety disorder. There are different ways to work with GAD, and as individuals, we are all going to have our own preferred way. Medication and or CBT can help. I offer my clients an integrative therapeutic approach, which involves first and foremost establishing a relationship that feels safe and comfortable, where the client knows there is no judgment and they can just be. Within that relationship, the client can talk about what they're experiencing. They may already have a diagnosis of GAD, or it may be apparent that this could be what the client is living with. We will then work together to understand more about the anxiety. Does the client remember when it started? Are there times when it's easier or more difficult? Are there times when the client remembers feeling okay for a long stretch of time? We can look at what can help the client in the immediate moment, for example, breathing techniques or grounding exercises, and also see if the clients can develop an understanding of themselves and where the anxiety comes from. Anxiety can run in families, and it may be as a result of a history of abuse or trauma. However, it can also develop for no apparent reason. Developing a greater understanding of oneself can help to understand why we feel the way we do, and in time to heal and grow using a holistic approach to support and envelop this. If you'd like to work with me, do get in touch. My website is www.amandamacdonaldtherapy.com. Thank you.